I actually studied two things. I do study sex differences in the brain, and I also study how female specific experiences influence the brain. So, like pregnancy and motherhood, hormone therapy, menopause. And I am really interested in how sex and sex hormones influence dementia as well as stress related psychiatric disorders. Even from the very first moments of the pandemic, thankfully, there were some people that were really interested in whether there were some sex and gender defects and on who was getting infected and how they were recovering or not from the disease known as COVID-19. And again, early on, people noticed that it was males that were more likely to suffer from mortality from COVID-19, but females were more likely to be infected with COVID-19 or the coronavirus, the novel coronavirus. And so when that first started happening, we were really, as all of scientists, we were kind of cut off from our research, at least for a little while, unless you did pandemic related research. That was like, oh, the doors are open. How do you know what is going to be really important in terms of informing the pandemic? We don't know whose piece of the puzzle will be important. And I made the case about there are sex differences in the immune system, and we know that already. We don't know enough about it. That's what I study. Can we go in and keep doing our work, and maybe we'll find a piece of the puzzle? So that's part of it. The other part is that as the pandemic went on and the lockdown measures were enforced, we saw a number of disparities, and we looked at psychosocial measures. We looked at depression, anxiety, loneliness, those kinds of constructs, and it was the women and gender diverse people that were showing endorsing this at a higher rate. But all of this is all intertwined. So there's the stress of the pandemic, but then there's also the sort of physiology of the ACE2 receptor and how a virus is getting into systems that all plays a role in these outcomes. So our collaborators are Dr. Gillian Einstein, who's at the University of Toronto, and Dr. Natasha Raja, who's at McGill University. And all of us are neuroscientists interested in Alzheimer's disease. That's sort of our the primary reason why we all have interacted before together. And I was thinking about doing a women's brain health conference and invited Gillian and Natasha to speak at it because of their work on women's brain health. And we just started talking probably at conferences and just about some of the things that we were noticing in the literature and about some of our struggles trying to do women's health research in the now. Oh, it's SGBA. Oh, SGBA means women's health, and no, it doesn't, because it's a separate thing. And so I think it was those kind of struggles that I think that's probably where it first started to germinate. There's a couple of things, actually. We're hoping to start a women's brain health database. So some of the variables that we are really interested in, like menstrual cycle, what hormonal contraceptives you're on, what hormonal therapy you're on, when did you have pregnancies, and how many of them did you have? Those variables aren't in a lot of databases. One of the things we want to get out of it is sort of join together to get more data and to get people more interested in women's health. I just did a podcast for Brain Canada, and they ask everyone, do you see any sex differences in their work? And nobody wants to answer that question. I think it's really important to have people that will stand up and say, it's okay to do this. These are the reasons why it's important to do this, and sort of hopefully have be those role models for people. So we have written the chapter already. We said we'd write, and our next goal is to do it, because that's going to be in a book, Principles of Gendered Medicine. I think it's better to have something in a like Nature or Science. That would be the way we really want to go to tell people, look, women's health is important, and there are many different things to consider.